Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamhi, the natural nurse who will help you take the leap to ultimate wellness.
And greetings. Thank you so much for joining me, Ellen Kamhi, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information in the many facets, the world of natural living. Today, I am so happy to bring on board as our guest Dr. Leslie Alexander. She's a PhD and RH, a clinical herbalist with a community practice based in Erie, Pennsylvania. As a scientist, Dr. Alexander focused on environmental factors affecting children's health. And she is a registered herbalist, which we will talk about, with the American Herbalist Guild, and also the author of a wonderful book, which will be our focus today, called Dental Herbalism, Natural Therapies for the Mouth. You can find out more at dentalherbalism.com or restorationherbs.com. Thank you so much for joining us today, Dr. Alexander.
Thank you for inviting me, Ellen. It's a pleasure to be here with you this morning.
Now, let's go back in time a little bit and talk about your history, because obviously you have a long education as a scientist. What brought you from that field into herbal medicine?
Well, that's an interesting tale. I would say that it was my love of cooking and gardening combined with what I saw when I was a researcher in the Department of Public Health. And speaking about the latter, I was very aware that there was a growing dissatisfaction, not only amongst healthcare providers, but also amongst many of the people that they worked with, their patient base, feeling that there were other ways to health and wellness. So as a gardener for many, many years, working with herbs that I brought to the kitchen, I began to become aware that these very same herbs also had medicinal properties when used in larger doses.
Well, thank you for sharing that. And of course, you're knowledgeable in many areas of herbal medicine. What made you decide on this particular book, Dental Herbalism, Natural Therapies for the Mouth?
Well, that's a good question, and it certainly wasn't a planned course of study and research. I, as you mentioned in my introduction, work as a community herbalist, working generally with women and children and men, of course. And I had a client whose symptoms seemed to improve and then taper off with improvement, and we had this sort of like staircase of practice and stalling and practice and stalling, and I came across some work by a man named Willoughby D. Miller, who said the source of inflammation could be found in the mouth. He's a dentist that practiced in Ohio in the late 19th century, and it was really coincidence, Ellen, that I came across his work. I spoke to my client and asked if she would be willing if I were to work in her mouth as well as internally. And so we began a series of poultices as well as tinctures, used both as an oral rinse and taken internally in a very traditional way. And her health profile seemed to improve in leaps and bounds. And that led me to the growing body of literature that links together the health of the mouth and the health of the body. and
so
all
true.
of that together.
Thank you for sharing
absolutely.
that. Very, very interesting, because as you say, that body of literature is expanding exponentially as we speak. There was just an article, I believe, last week looking at the connection between gum disease and heart disease. And these are being published at Harvard Medical School. This is not, the New Age Journal.
Yeah, exactly. And I think as science, Western science as we know it, supports our use of herbs to improve health and wellness and to support health and wellness, there's growing confidence in the general public. But it makes perfect sense if we draw an analogy. For example, if I'm out, jogging in the street and I trip on the curb and scrape my shin, I'd clean that abrasion to avoid not only a localized infection, but also a systemic issue. And when we experience any bleeding in the mouth as a result of dental cleanings or daily brushing or flossing, for example, that opens up one pathway where microorganisms that normally reside in the mouth can enter the bloodstream. And then, as is the case with some infections, they find their way to the weakest part of the body, and that indeed may affect cardiovascular health or pregnancy or any number of other conditions.
Right, and they know, of course, how it finds its way, because there are all kinds of circulatory and communication pathways in the gums, particularly under the teeth and the roots, and they actually connect directly to the circulation that goes to those organs that you just mentioned. So it's not really mysterious. It's almost mysterious why it wasn't discussed earlier on.
I agree with you. It wasn't until I was an adult that I realized that the teeth, the internal aspect of the teeth, a structure called the pulp, actually was supplied with a regular blood supply. And I grew up in an era where I was encouraged to brush my teeth solely for controlling mouth odors or halitosis, bad breath. But it wasn't really clear to me that cleaning and taking care of my mouth was a very, very important part of my daily routine.
As I'm sure is true for most people, even still. And I'd like to remind you, listeners, that my guest today is Dr. Leslie Alexander, PhD, RH, and she, among her many attributes, is also the author of the book that we're talking about today, which is called Dental Herbalism. And I'm looking right at it. It's a beautiful book with so much information that can help you and your family, and as she says, from infancy to old age. So that's a very, complete description of how people can care for their mouth. And of course, everything you talk about, Dr. Leslie, is from an herbalist perspective, so from a natural perspective. I don't think you're talking about, let's say, using one of those fluoride rinses every day.
No, I'm not. Fluoride is a neurotoxin, a class 1 neurotoxin, and even though it finds its way into many commercial toothpaste, those very same preparations say, if swallowed, please call poison control. So that always left me with a little bit of suspicion and a total lack of confidence in the products I was using to care for my mouth.
Right. So what you're going to be talking about in your beautiful book are really all natural ways to achieve the best health possible in your mouth, and then you look at it in a larger perspective on how that affects overall health everywhere from infants and toddlers to old age and every other part of life. So it's very comprehensive.
Thanks. Yeah, we worked carefully together. I co-authored the book with Linda Straub-Bruce, who is a practicing dental hygienist and had been in practice when our book came out in 2014 for more than 20 years. So together we bring a great deal of expertise from different perspectives. And as you rightly say, the focus of the book is using common, everyday, safe, and effective herbs to care for the mouth, whether we're talking about working with infants who have yet to have their teeth emerge, which, by the way, I don't know if many people know this, but by about 20 weeks in utero, both a child's what we call baby teeth and their permanent teeth have already been formed. And so we talk about infant oral health and also health as adults, hoping that our teeth will last us a lifetime.
Well, my dad, who's 94, is still dealing with teeth issues even now, so I don't think it ever ends, as you point out. So before we go deeply into, how you would use specific herbs for specific healthy mouth issues, and again, this is from the book, Dental Herbalism, Natural Therapies for the Mouth. We're speaking with co-author, Dr. Leslie Alexander. Let's talk a little bit about RH, because you are a PhD, you're also an RH. Let's just explain a little bit what RH means.
Absolutely. It's a great question, and thanks for asking that, Ellen. So RH is a designation which is offered by the American Herbalist Guild, which stands for Registered Herbalist. So why is that important? Well, these days, as herbalism grows increasingly popular, I notice that more and more people are saying, hey, guess what? I'm a herbalist. And I think to myself, well, that's great. I'm really excited that you're interested in herbs and want to use them. But what sort of training do you have? And when we explore this, I'm finding that people who call themselves herbalists come from any number of backgrounds. Some of them have learned herbs through the tradition of apprenticeship or from their elders, and have grown up in the midst of a wealth of experience relating to the safe and effective use of medicinal herbs. And other people have shorter, perhaps more casual paths of study. RH, or Registered Herbalist, means that for me and many others, and I know you're an RH as well, it means that we have hundreds of hours of not only clinical experience, but also a wealth of time spent learning about health and wellness with traditional topics like anatomy and physiology. And when it comes to our herbal practices, our work, our interventions, our protocols have been peer-reviewed by a committee of esteemed herbalists. So RH comes after that review.
Thank you for that description. And we're going to go for a break here on Herbally Yours. When we come back, we will continue our discussion with Dr. Leslie Alexander, talking about her book, Dental Herbalism. And I'd like to remind you that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. Listen live online at nccradio.org or on iHeartRadio. For more information on today's guest or topic, email us at whpc@ncc.edu. Stay tuned. Herbally Yours will be right back.
Hi, I'm Dr. Anita Chandra with today's tip for kids from the American Academy of Pediatrics. Do you want to know the secret to baby brain development? It's you. Your baby's brain develops rapidly in her first few years.
2 apples on top.
So talk to her, read and sing as much as you can starting from birth. You don't need fancy toys. Play peekaboo, read a book, or just talk about your day. For more information on baby brain development, talk with your pediatrician or visit healthychildren.org.
You took the first step and quit smoking, but even former smokers may still be at risk for lung cancer. That's why SaveByTheScan.org wants you to know about a new low-dose CT scan that can detect lung cancer early. It takes only 60 seconds and could save your life. You took the first step, now take the next. Visit SaveByTheScan.org for a simple quiz to see if you're eligible and talk to your doctor about screening. SaveByTheScan.org is brought to you by the American Lung Association's Lung Force Initiative and the Ad Council.
And welcome back. Thank you so much for joining us. And you can always find out more at naturalnurse.com. If you look at calendar, you will see all the classes that we do. As a matter of fact, we often meet at the Oyster Bay Library as part of the American Herbalist Guild. We also have meetings in Seacliff and in Suffolk County, and they're always free. They're open to all. We go on herb walks. We talk about different herbs for the holidays, all different kinds of topics, and they're all 100% free to the public. Just go to naturalnurse.com under calendar, and you can see the many workshops, lectures, online and on-ground classes that we give just about every single day, including today. It's like every single day. So just check naturalnurse.com calendar. And today we're so happy to have as our guest Dr. Leslie Alexander, PhD RN, clinical herbalist, and she is a registered herbalist with the American Herbalist Guild and author of Dental Herbalism, Natural Therapies for the Mouth. And it's really a beautiful book. You know, Dr. Leslie, it's really scientific, but it's put together and written for anyone to use.
That's true, Ellen, and that was a very strong intent that both I and Linda held as we wrote the book, and we received a little bit of criticism in the writing as we really focused our efforts to write for 3 audiences. So dental herbalism can, of course, be read from cover to cover. However, some people may not choose to do that. And we wrote for herbalists who really don't have much experience in the mouth at all. Quite often, a herbalist, for example, might ask to see their client's tongue, but they don't look beyond the tongue or even at the lips. And for the dental community who are working with populations increasingly using herbs, but have little understanding of their efficacy or combinations or even various forms of dosing. So we wrote for the dental community and the herbal community. And we also wrote for, I like to say, Mr. and Mrs. McTavish, people out there every day who needed an affordable resource that was clearly written without jargon to help them not only understand the mouth, but also how they could work in the mouth safely and effectively, and also affordably. Finances were a big consideration as we drew from the hundreds, and seriously, hundreds of herbs that have been used all around the world. We wanted to provide our readership with herbs that were, in many cases, local, if we're talking about the Northeast, and safe and effective.
Okay, well, let's get into some of the herbal remedies that you describe in depth in the book. The recipes are wonderful. And if people, let's say, didn't know how to find an herb locally, this is new to them, I imagine you also discuss off-the-counter things they can purchase besides making a remedy at home.
Absolutely. So the book has a number of appendices, all of which we are keen for people to copy and print out and use. They include a wealth of resources, a checklist of symptoms, and also suppliers of herbs and oral care products are featured in Appendix 2, as well as, I would like to say, in Appendix 5, we offer some oral health charts, and a great place to start learning and caring for the mouth is to get to know our mouths. And years ago, when I went to a dentist, and they might say, oh, you need a filling, or, oh, possibly we should watch this tooth, there's a pocket in your gum, or perhaps you need a root canal, whatever the intervention, I never really asked for specifics. And it was quite remarkable, Ellen, for me to realize that I'd sort of abdicated the health of my mouth to an oral care specialist, and I never even knew what teeth were worked on or when or why. So using the charts in the back of the book for ourselves and also for children, and beginning to create a health diary or a health history for young people to take with them as they move out of the home, I see those as very important places to begin.
Well, let's talk about something specific, because believe it or not, I just wanted to remind listeners that you're listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamhi, the natural nurse, and my guest today is Dr. Leslie Alexander, PhD, RH, and author of the book Dental Herbalism, Natural Therapies for the Mouth. So let's talk about something that people could incorporate immediately. Like, what would be a good way to keep your teeth clean versus just using commercial toothpaste?
Oh, wow. What a great question. So there are any number of powders and pastes that are available on the market. And these are fluoride-free, and they also often contain an abrasive to help whiten and remove debris from the mouth. Add to this, perhaps, a technique of oil pulling, which helps to clean those spaces in between teeth.
So wait, I want you to describe that. How would people do oil pulling?
Of course. So oil pulling comes from the technique from the tradition of Ayurvedic medicine, and it originally and historically has been done with sesame oil, which has a notable place in that tradition of herbalism. Here in the West, we can use sesame oil, of course, or olive oil or coconut oil. And I would suggest that most people would start with, say, a teaspoon or perhaps even half a teaspoon and work up to a tablespoon or more. And what oil pulling is you put the oil in your mouth, and then you don't swish it around, but you sort of thread it through the spaces between your teeth in a really focused manner, starting, for example, in the upper left quadrant. So that would be the upper jaw, and thinking in our minds, yes, I need to move this oil between my teeth and sort of thread it around my teeth through a pushing and pulling. That's why it's called oil pulling. So we're pushing oil out towards the gum, towards the cheek, and then pulling it into the center of the mouth, pushing it out and pulling it in. And then you spit this oil out into a container with a lid. I don't suggest putting it down the drain or the toilet because excessive oil could clog the pipes. And this is a technique that would be done in the morning, just as a part of regular morning hygiene.
Yeah, and it feels really good. I do that often. It's really fun. Once you do it, you go, why wasn't I doing that? Because it makes your mouth actually feel really clean. And what are some of the benefits of doing something like oil pulling?
Well, the obvious benefit immediately is removing debris. So many people choose not to floss, and yet when we use a traditional toothbrush, we're really not cleaning each of the surfaces of the teeth. So oil pulling allows us to clean between teeth. It also works to remove debris and microbial debris from the mouth. It works to oxygenate the gums. And many people seem to report profound effects on skin health, reducing flare-ups relating to acne and improving digestion. And of course, we all know that digestion begins in the mouth.
That's true. It's all one connection. And you have so many wonderful tips in this book. I'm so sorry that we're not going to get to talk about too many of them, but one that people probably heard of that's really part of general knowledge is using cloves for pain in the mouth.
Exactly. Cloves is a very old intervention, and we can use dried cloves purchased from a reputable health food store, or we can use clove oil. In the case of clove oil, we might add 1 drop of a pure essential oil from a reputable supplier into a carrying oil, particularly for very young children or people who have sensitive mouths. And we can apply that to the gum, for example, with a Q-tip. In the case of a clove, we would simply place it at the point of inflammation or pain. And one of the things that I really like about talking about herbs for the mouth is that we can rely on so many everyday kitchen herbs without undue expense to deal with things like pain or inflammation. Remembering, of course, that pain and inflammation are signs that something is amiss, and we may well need to see an oral care specialist.
Okay, well, thank you so much, and we are out of time. I want to thank our guest so much, Dr. Leslie Alexander, author of Dental Herbalism, Natural Therapies for the Mouth. It's a book you want to have in your home. And I want to thank you so much for listening and tuning in to Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamhi at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.